Morning to all. I am Dr. Ajay. I am a ENT faculty for your NEET and PGI exams. So, I hope most of you have given the PGI exams last week. Okay, and I hope it was somewhat better than the previous years or the November exams. Okay, and today we are going to discuss about the ENT recall questions. These are not the exact questions which was not in exam, which was asked in exam. These are just a recall question which was collected from the students. Okay, so we are going to discuss the PGI questions which were asked last year. Okay, and in ENT every year there will be some 5 or 6 questions, and most of them will be pointed towards some which of the following statements are true or false. Okay, so we will go to the questions. Question number 1. So, which of the following statement are correct regarding nose? This was the question asked. Okay, and what was the option? Option A, unilateral polyp is most commonly associated with severe pathology than bilateral polyp. What do you think? This is true or false? This one is false, obviously false. So, what happens? We want to know about the polyps. Okay, we want to know about the polyps, whether it is unilateral or bilateral. So, unilateral polyp is otherwise called as antrochoanal polyp, right. Bilateral polyp is otherwise called as ethmoidal polyp, right. So, antrochoanal polyp usually more common in children, okay, and it starts from the maxillary sinus and extends up to the choana. Okay, sometimes it can extend up to the oral cavity also, but the ethmoidal polyp, it starts from the ethmoid sinus. Okay, what it does, it is bilateral and is more common in adults. Okay, and it even causes erosion of the, it goes up to the skull base. It can even cause erosion of skull base, leading to CSF leak and complications. Okay, so this bilateral polyp is more severe, it has more pathology than the unilateral polyp. Okay, so the answer is, it is false. Okay, coming on to option B, septal hematoma needs to be treated immediately. This even a pre-final student knows. So, any hematoma we can't leave it as such. Okay, if we leave it as such, it may turn into abscess, right. So, the septal hematoma, if we leave it as such, it will turn into abscess immediately, then it may lead to even a septal perforation. So, the septal hematoma should be treated immediately. What you want to do? You need to drain the hematoma immediately. Okay, so the answer is true. So, coming on to option C, sphenoidal sinus drains into the middle meatus. Is it so? No, the sphenoidal sinus will drain into the sphenoethmoidal recess and not into the middle meatus. So, the answer is false. Okay, for this we want to know which of the sinuses drain into which areas. Okay, so what are the sinuses? We know one is a maxillary, ethmoid, which is anterior ethmoid, and frontal, posterior ethmoid, and sphenoid. Okay, so the maxillary, which are the anterior group of sinuses? The maxillary, anterior ethmoid, frontal. These three are anterior group of sinuses. These three drain into the middle meatus. Okay, the posterior ethmoid, which is posterior, it drains into the superior meatus. Okay, and the sphenoid sinus will drain medial to middle meatus, which is called as sphenoethmoidal recess. A very important MCQ which has been asked now. Okay, and what drains into the inferior meatus? The nasolacrimal duct drains into the inferior meatus. Never forget this slide. Every year there will be some MCQ, not now. Okay, it has been there for the past some 5 or 6 years. Every year there have been some MCQs from this question. Okay, from this drainage pathways. Never miss it, very easy one. Okay, so the answer is, it drains into the sphenoethmoidal recess. So the answer is false. Because going on to option D, epistaxis from the anterior part of the nose is more complicated than the posterior epistaxis. Is it so? Obviously not, it should be false. So, what is anterior and what is posterior epistaxis? So, for this we need to know about anterior and posterior epistaxis. So, anterior epistaxis, posterior epistaxis. So, anterior epistaxis is more common in children. Again, which area it is involved? It involves the little's area of nose. So, once there is a bleeding from the little's area, even if we do a small maneuver, okay, like a pinching maneuver, it will stop, and it most commonly following a nasal trauma, that is either a nose pricking. Okay, if it is a posterior epistaxis, it is more common in adults rather than children. okay, and the most commonly it following a hypertensive bleed, hypertensive. The area is Woodruff's plexus along the posterior end of the lateral wall of the nose. Okay. So, this is more dangerous as the patient will have even a nasal bleed and the patient will have a intraoral bleed and the patient keeps on swallowing the blood. Okay. So, this is more dangerous. So, the answer for this fourth one is epistaxis from the anterior part of the nose is more complicated than the posterior part of the nose, which is obviously a false statement, right. So, the posterior part is more dangerous. So, coming on to the option E, septal defects should be treated with surgery. Is it so? Is it so? Yeah, obviously the septal defects like any septal perforation or any septal hematoma or any septal abscess, okay, we are going to give any medication for septal abscess, but what they mentioned is septal defects. The defects indicate there should be some perforation or a deviated, gross deviated nasal septum. Okay. So, the deviated nasal septum or the septal perforation, these are septal defects and there is no medication for that. Septum is a cartilage. Okay. So, anything should be treated with the surgery. If there is a problem, it should be treated with the surgery. So, the answer is true, right. So, in the statement option B and E are true and the rest are false. Okay. So, coming on to see PGI is a multiple choice question. So, we need to read all the options again and again to make it correct and we need to make it sure that we are not marking much of a negative answers. The negative questions or the negative answers carries much of importance for you to gain a good rank in PGI. Okay. So, coming on to the next one, which of the following is incorrectly matched? Again, this is a very easy one. Option A, fluctuating hearing loss with tinnitus. Whether it is seen in Meniere's, answer given was Meniere's. Yes, the answer is true. What happens in Meniere's? What are the characteristics of Meniere's? In Meniere's disease, what is the characteristics of Meniere's? There will be 4 characteristics of Meniere's. Okay, there will be fluctuating sensorineural hearing loss. Why they are mentioned as fluctuating? That means every time the patient has an episode of vertigo, again it is a episodic vertigo. Okay, episodic vertigo which lasts for just 20 minutes. Okay, 20 minutes, 20 seconds to 20 minutes and not more than that. So, whenever the patient has episode of vertigo, he will have a feature of hearing loss also and this hearing loss will become normal once the vertigo stops. So, it is called as fluctuating hearing loss, fluctuating. And what is the type of hearing loss? It is a sensorineural hearing loss. So, characteristics of Meniere's is there will be episodic vertigo with fluctuating sensorineural hearing loss along with tinnitus, along with oral fullness, that is a ear blocking sensation. These are the 4 characteristics of Meniere's. So, when the option is true or false, obviously it is true. Okay. So, coming on to option B, deafness associated with the puberty. Is it seen in presbyocusis? So, what is presbyocusis? Presbyocusis indicates a old age sensorineural hearing loss. So, what is the option here? Associated with puberty. Is it so? So, the answer is obviously false. Okay. In ENT, there are 2 conditions which worsen, there is a condition which worsens with puberty and pregnancy. That condition is a conductive hearing loss caused due to otosclerosis and not a presbyocusis. Presbyocusis is a old age sensorineural hearing loss. Okay. And coming on to, so the answer is false. Okay. Coming on to option C, progressive conductive hearing loss seen in otosclerosis. Is it true? Is it true? Obviously yes, otosclerosis presents with a conductive pattern of hearing loss and the patient usually the patient will be a, what is the characteristics of otosclerosis? Whether it is a unilateral or bilateral, the patient usually most common in female, okay, and the patient will present with bilateral, painless, there won't be any pain since it is not an infection and it is a progressive one, okay, and it is a conductive pattern of hearing loss which is increased during pregnancy, okay, or puberty or menopause. A very characteristic one, most common in female. So, the answer is it is true. This one is true. Okay. So, coming on to option D. Okay. progressive sensorineural hearing loss seen in presbyocusis. As I said, what is presbyocusis? Presbyocusis is old age sensorineural hearing loss, right. So, presbyocusis, as I said, old age sensorineural hearing loss. Obviously, we have seen lot of our grandparents, okay, they are getting the grandparents getting a hearing loss is presbyocusis. So, how will be the hearing loss? Even we, after 40 or 50 years, we are going to have a mild hearing loss, and as the age progresses, if we live till 80 years of age, our hearing is going to worsen, worsen, worsen and worsen, okay. That is a progressive sensorineural hearing loss seen in presbyocusis. So, the answer is true again, okay. This is a true one. This is not the answer what I am mentioning, okay. And coming on to option E, deafness increase during pregnancy, what I mentioned now, okay. Otosclerosis is a condition which increases during pregnancy, during puberty, or during lactating mothers, or during menopause, okay. So, it is a true statement again. So, the question asked is, which of the following statement is incorrectly matched, okay, which of the following statement is incorrectly matched. So, the first one is correctly matched, so it is not the answer. The second one, it is incorrectly matched, this is a false. So, the answer is option B, this is the only one which is incorrectly matched, okay, rather than the rest all are correctly matched, this is the one which is incorrectly matched. So, the answer is option B, clear. We need to read it again, incorrectly matched. So, the answer is option B, right. So, coming on to question number 3. Okay. So, there was one audiometry, again I mentioned in my previous YouTube video, I mentioned a query about audiometry, okay. So, audiometry is one important point for the examiners, okay. They will put on some image based MCQ, they may ask some which of the following statement is true or false. Every year there is a question on audiometry, and again I am mentioning last video was mine regarding audiometry, just go through it in my YouTube channel. Last video I have mentioned about audiometry, how to read audiometry, and here I am just reading this audiometry again. So, which of the following statement are true regarding audiometry, this audiometry, okay. So, here what I have mentioned, so how to read audiometry? In audiometry, just you want to know what is the WHO standards. So, WHO standards is 0 to 25 decibel is normal, anything more than 25 decibel is abnormal, okay. So, mark a line between 0, 10, 20, 30 or so, this 25 decibel, anything, any line above this is normal, any line below this is abnormal, okay. So, coming on to this one, so mark this as a 25 decibel line, okay. So, this is a bone conduction, this is a hand conduction. Obviously, the bone conduction will be in the above end and the air conduction will be in the lower end, okay. So, here what I said previously, if both lines are in the normal range, okay, if both the lines are in the normal range, it is normal, okay. Say if one line is in the normal range and the other line is in the abnormal range, there occurs a air bone gap between the two lines. This is the bone conduction, this is air conduction. So, there occurs a air bone gap between these two lines. So, if there is a air bone gap of more than 15 or 20 decibels, it indicates the conductive pattern of hearing loss. More than 15 or 20 decibels, it indicates a conductive pattern of hearing loss. So, this indicates a conductive. What is the one more pathology? The sensorineural hearing loss. So, how will we do a sensorineural hearing loss audiometry? So, I am just rubbing this one, okay. So, what I mentioned here, 0 to 25 decibel is normal, okay. Say this is the first line I am drawing. This is the first line I am drawing, this indicates a bone conduction. This is the second line I am drawing, this indicates a air conduction. Say now both bone conduction and air conduction both are in the abnormal range, okay, that is less than 25 decibel. When both are in the abnormal range and there is no airborne gap, this indicates a sensorineural pattern of hearing loss. So, 3 types of audiometry: normal, conductive, sensorineural, okay, clear with this. So, going on to the question now. So, here the bone conduction is normal, the air condition is in the abnormal range, say it is around the 40 decibel range. So, what is the type of hearing loss? And there is a air bone gap. This indicates a air bone gap is there. This indicates air bone gap of around, so here it is 0, here it is around 40 decibels, right. This indicates the audiometry shows a conductive pattern of hearing loss, okay. So, now rule out the option. Option A, the audiometry shows a sensorineural pattern of hearing loss, is it so? we explained it fully, it is false statement. This shows a conductive pattern of hearing loss. Option B, conductive pattern, yes, the B is true, it shows a conductive pattern of hearing loss. Option C, Carhart's notch is seen. What is Carhart's notch? What is Carhart's notch in audiometry? Carhart's notch is nothing but a dip in bone conduction. Dip in bone conduction at 2000 hertz is called as Carhart's notch. Okay. Is there a dip here? Is there any dip here? No, there is no dip. There is no dip. Okay, there is no dip in this bone conduction. The Carhart's notch should be like this. The bone conduction should be normal. Only there should be a dip in bone conduction at 2000 hertz. 2000 hertz. Okay. So here we can't see any Carhart's notch. So the option is false. Okay. Option D could be a case of presbyocusis. In the previous question I explained what is presbyocusis. Old age sensory neural. Old age sensory neural hearing loss. Here the option is a conductive pattern of hearing loss and not a sensory neural pattern. So the answer is false again. Okay. Option E can be seen in ossicular discontinuity. Could be, yes, ossicular discontinuity. What is the type of hearing loss in ossicular discontinuity? Ossicles. So what is a conductive hearing loss? Starting from the pinna to the external atrial to the tympanic membrane to the ossicles up to the footplate of stapes up to the oval window, it is a conductive, any pathology involved, it is a conductive type of hearing loss. Okay. So this can be seen in ossicular discontinuity, which is a conductive pattern of hearing loss. Obviously yes, ossicular discontinuity presents with a conductive pattern of hearing loss. So the option is true. So here which of the following statement are true regarding audiometry? Option B, option E. B and E are true, the rest are false. Okay. So coming on to the next MCQ. Next MCQ, question number 4. Which of the following are true regarding Gradenigo syndrome? So this is a very simple and a repeated MCQ. What is Gradenigo syndrome? Gradenigo syndrome. What is a triad of Gradenigo syndrome? So Gradenigo syndrome is nothing but it is a Gradenigo syndrome is nothing but acute petrositis. Okay, petrositis, the complication, head and neck complication following a CSOM is a masteritis. The next one is petrositis. Petrositis is nothing but involvement of the petrous apex. Okay. So what is the triad of Gradenigo syndrome? The triad of Gradenigo syndrome is the patient presents with obviously there is a petrositis, right? Obviously there is a masteritis. So the patient will present with a ear discharge, right? And there will be sixth nerve or the lateral rectus palsy. So there will be diplopia will be there. And the third point is because of the involvement of trigeminal nerve, fifth nerve, trigeminal nerve, there will be retroorbital neuralgia or retroorbital pain. Rather than neuralgia, there will be most of a pain. So there comes a now, this is the triad of Gradenigo syndrome, which you should not forget, right? The patient will have a ear discharge, the patient will have, even because of the conductive, the patient will have a conductive pattern of hearing loss. There will be a hearing loss because there is a fluid inside the middle ear. Okay. So ear discharge and a conductive pattern of hearing loss, and there will be a sixth nerve or the lateral rectus palsy, and there will be a retroorbital pain because of the trigeminal nerve involvement. Okay. So this is Gradenigo syndrome. So why there is involvement of sixth and fifth nerve? So now what happens is, in this, if this is the petrous apex, so what happens is, if this is the petrous apex, I am just marking it. Okay. In the petrous apex, near the petrous apex, there occurs a sixth nerve canal, which is a Dorelov canal. Okay. And here there occurs a trigeminal ganglion. Okay. So sixth nerve canal and the trigeminal ganglion occurs in this petrous apex area. So if there is involvement of this petrous apex, there will be involvement of sixth nerve and the trigeminal ganglion. This is called as Gradenigo syndrome. Okay. So going on to the answers. Okay. Which of the following is true regarding Gradenigo syndrome? One, retroorbital pain. Is it true or false? Obviously it is true, which is we discussed, because of the trigeminal nerve. Will there be vertigo? Again, Gradenigo syndrome involves middle ear and not the inner ear. So there won't be any vertigo, right? Will there be lateral rectus palsy? Yes, there is involvement of sixth nerve. So, the option is true, there will be involvement of lateral rectus palsy. Will there be ear discharge? Obviously yes, it is a complication of CSOM. So, it is true again. Okay. Will there be facial nerve palsy? Facial nerve palsy, seventh nerve does not come in this petrous apex area. Okay, seventh nerve goes into the middle ear or into the mastoid part. So, it does not come in this area. So, the option is false. So, which of the following true regarding Gradenigo syndrome? Option A is true, option C, option D. These three are true. Okay. So, this is a easy one, this is a repeated MCQ also. Okay. So, coming on to the next one, and this was the fifth MCQ asked, and this hopefully this is the last MCQ. So, which of the following statement are true regarding fracture of maxilla? Okay. So, this maxilla is getting fractured. Okay. So, read out the question. Option A, diplopia due to direct eye injury. So, what are the reasons? Say if the maxilla is fractured, what will happen if the maxilla is fractured? Just think. Okay, if you do not see this, most of you have left out this fracture topic, just think. Okay, PGI questions, the question may sound somewhat difficult, but when you read the option, you can just think and answer. Fracture of maxilla. So, maxilla is involved. Which is the roof of the maxilla? The roof of the maxilla is the, say if this is the maxilla, okay, the roof of the maxilla is nothing but the floor of the orbit. The orbit is going to be here. The roof of the maxilla is the floor of the orbit. Okay. So, if there is fracture of the maxilla, okay, what will happen? There is a fracture of maxilla. Say this part is getting fractured. Okay. The orbital contents here, okay, may enter out through this gap into the maxilla. Okay. So, there will be involvement of a inferior rectus muscle or a inferior oblique muscle. So, obviously there will be diplopia. Diplopia is going to be there if there is a fracture involving the roof of the maxilla. They did not mention that roof or the floor and all. Okay. They just gave a fracture of maxilla. So, we have to imagine that the fracture has involved the roof or the floor or the lateral wall, we need to imagine like that. Okay. So, if there is a fracture of the roof of the maxilla, then there will be obviously diplopia will be there. So, the answer is true, right. There has to be diplopia. So, the option is true. Okay. CSF leak may occur late. Again we need to think the fracture of maxilla can be anything, right. So, we need to have in mind the fracture of maxilla which is a Lee-Ford fracture or the midfacial fractures. So, Lee-Ford fractures or a midfacial fractures are nothing but the fractures which involves the maxilla and extend from one area to the other area. Okay. So, usually if there is a plain fracture of a maxilla, so the maxilla is nowhere connected with the, okay. So, one minute, just a minute. So, if there is a plain fracture of maxilla, so if this is the maxilla here, okay, and this is the nose here, this is the nose, this is the maxilla, this is the orbit here, okay, this is the ethmoidal cavity here, I am drawing a ethmoidal cavity, okay, and here I am drawing a cribriform plate of ethmoid. So, if there is a fracture of cribriform plate of ethmoid, then there occurs a CSF leak. Okay. But fracture of maxilla, will it cause a CSF leak? Obviously no. Okay. But there is one condition of maxillary fracture which is a Lee-Ford fracture, okay, which runs from the maxilla, it extends up to the tip, okay, it extends up to the tip, that is a type 2 Lee-Ford fracture. I am not mentioning about type 3, type 2 Lee-Ford fracture, it starts from the maxilla, okay, it goes up to the tip of the or the roof of the ethmoid and then bisects the other side also. Okay. So, but usually a CSF leak may occur only in the condition, but here they are not asking about Lee-Ford fracture, they are asking only about the common fractures of maxilla. So, CSF leak is usually very rare. Okay. So, CSF leak obviously if it occurs, it is because of maxillary along with the ethmoid fracture. So, obviously it will be a late one. So, option is true. Okay. It does not mean that CSF leak never happens, it can happen, but it may occur late. So, option is true again. So, option C, infraorbital nerve is involved. So, what is the nerve supply of maxillary sinus? So, anything say if they ask you the maxillary cancers or maxillary tumors or any maxillary fractures, the nerve involved is this one, the infraorbital nerve which runs through the infraorbital foramen. Okay. So, So, where does the infraorbital nerve runs? Here there will be infraorbital foramen through which the infraorbital nerve runs. So, any conditions involving the maxilla, the nerve to be involved is infraorbital nerve. So, again it is true. Okay. The fracture, option D, fracture can be seen on a plain X-ray. Obviously it is difficult, okay, but a X-ray, if it is a very displaced fracture, we can see. What they have asked, through a plain X-ray, can you see a fracture? Obviously yes, we can see a fracture. If the fracture is, say, if it is undisplaced fracture, it is very difficult to find, but they haven't mentioned about displaced or undisplaced. They have said, they have asked fracture, can it be seen through a plain X-ray? Obviously we can see through a plain X-ray. Okay, we can't see if it is an undisplaced or an airline crack, we can't predict that, but it can be seen through a plain X-ray. Okay, so the option is true again. The option E, patient is asked to clear his nasal cavity in case of any clot of blood is present. Is it so? The patient, if it is a maxillary fracture, if it is a fracture involving this maxilla, obviously the patient is going to have a epistaxis. The patient, because of a sinus cavity getting collected, filled with blood, the patient is going to have a epistaxis, right. So, do we say the patient to strain a lot to bring the blood clot out? Obviously no, the hemosinus is not going to create him any issue. We will first advise him not to do anything. Okay, if we just keep on sniffs his nose, or if he keeps on struggling with the maxilla, it is going to get displaced, or if it is going to get injured again. Okay, so the answer is false. Okay, so we are going to do a suctioning, or we are going to give him some nasal drops to clear the blood. Okay, so the answer is false. Okay, so in this question, option A, B, C and D are true, option E is false. Okay, so coming on to the end of our PGI questions, I hope this would be a very useful point for you to attend the next exams, or those who have done the PGI exams. Hope I wish you very all the best to get a good seat in a PGI, and I hope this PGI was a bit easy also. So, all the best for everyone who shined this year in PGI, or those who are appearing for next year exams. I hope this will be a very useful, since most of the repeats are from previous question paper. So, thank you. Any doubts in this? Any doubts or any suggestions needed with this, or any further questions to add? You can just text me up in my number. Okay, you can just WhatsApp me in my number, or you can just mail me in my mail ID also, ajaimuthu@yahoo.co.in. Okay, any suggestions, you can text me or mail me up, or you can follow me up in my Facebook page, which I will share it again, which is Dr. Ajay is exploring ENT. Or in my Telegram page, which the link will be shared in my Facebook page. Okay, you can follow in my Facebook page and my Telegram page. In my Telegram page, if you search with the same name, Dr. Ajay is exploring ENT, you can join that page. Okay, thank you.